Hello and happy Tuesday, everyone. We would like to welcome you to our next episode of Live and On Call with Lake Charles Memorial. My name is Allie and I will be your host today. This is an opportunity for you to hear from local medical professionals and ask questions about topics that are important to you and to your loved ones. So we're all here to learn today. Don't be afraid of asking questions. This is supposed to be an interactive experience. Throughout our conversation, if questions come up or thoughts or just you need advice on any particular topic pertaining to today's episode, just go ahead and drop your comments in the questions below. And at the end of our discussion, we will get to answering these questions. So as people are joining us, I'll kind of introduce today's topic. We're going to be talking about the ABCs of safe sleep. So ensuring a safe sleep environment for your baby will put your mind at ease and allow you and your baby to sleep peacefully at night. Today, we are joined by Dr. Treme. She is a pediatrician with the Children's Clinic of Southwest Louisiana. Dr. Treme sees our littlest and our tiniest patients and helps answer questions every day for parents, ensuring safe sleep environments for their children. Dr. Treme, I'm going to bring you up right here.
Hi.
Hey, how are you?
Doing well. How are you?
Good. Thank you so much for joining us.
I'm really excited to be here.
Great. So why don't you take a second to introduce yourself a little bit more and tell us about your passion for safe sleep education and awareness.
So like you said, I'm a pediatrician at the Children's Clinic. I've been there for 5 years, and I think every pediatrician is pretty passionate about safe sleep. We've all seen bad outcomes. We've all seen kids die. We've worked in the emergency rooms in residency and watched those things happen. I very vividly remember my first infant death that I saw actually in college working in a local emergency room, and that has never left me. So it's something that I've been passionate about for years. In the last couple of years, I've gotten to be a part of some community organizations where I've met a lot of great advocates in our community, the Child Death Review Committee, the Safe Sleep Task Force, and even the coroner's office. So we have a lot of people who are really pushing for safe sleep in this community, and it's exciting to be a part of it.
Well, I'm just so glad that you're passionate about this education. A lot has changed since our parents were having babies, and we really just need to know that we can rely, especially on our pediatrician, to help us understand how to keep our babies safe. So for those of you, again, listening today, if you're just joining us, just a reminder that if you have questions during our discussion, please put them in the comments below, and we will get to them at the end of this discussion. So Dr. Treme, I'm sure the new parents that you see that come through your doors have a lot of concerns. They're thinking about, is my baby eating right? Is it sleeping right? Is, are these milestones happening at the correct time? But how often is safe sleep on their radar?
I would say most parents have thought about that. The moment that you get pregnant, the first thing that comes to your mind is, I've got to protect this child. That's my job now. I've got to do everything in my power. And so they're looking at car seats, they're looking at cribs, they're looking at all the things that are important to keep their baby safe. And, they have a ton of questions, usually in the beginning, and they generally have a plan. But I don't think anyone can truly prepare you for how hard that newborn period is, that first month or really 2 months of your baby's life. And so, having a plan is great, but realizing that your plan may change a little bit over time is what I see a lot of my parents do. Around a month, when they come in for that second checkup, they are exhausted, and that's when I think they stop making decisions that they thought they would make early on, and things kind of change. And that's when we really start delving into what can we do to make your baby sleep safer, better, and also safer. Yeah.
Awesome. So just before we go too deep into the conversation, I wanted to define some terms. So we're thinking of safe sleep. I think of SIDS, but I know that there's also other causes, suffocation. Are these really the same thing, or what are the differences here?
Yeah, so I think a lot of people do get confused about this. The term SIDS, or SIDS, sudden infant death syndrome, is used for a lot of causes of childhood death out in the community, but in reality, those are not all SIDS deaths. So sudden infant death syndrome is when a baby under a year dies with an unidentifiable cause. So an investigation is performed and we don't really know what happened. We know there are certainly risk factors that can make that happen more commonly, but we don't have a good explanation of why it happened in that particular child. SIDS is part of a broader category called SUIDs, SUID, so sudden unexpected infant deaths. So that is a broad category that includes all babies under a year old that die unexpectedly. So it's not that anything intentionally happened, but we may have a cause for those deaths. And that includes suffocation and strangulation.
Gotcha. Okay, so that's good to have that in our minds, that separation of what those two mean and what those terms mean. So as we go forward with this conversation, so the name of today's topic is the ABCs of safe sleep. Excuse me, which stands for alone, on the back, and in a crib. Why are these three areas so important? Why do we need to remember this acronym?
So these three things do help prevent SIDS deaths, but they also are very important in preventing strangulation and suffocation deaths. So the A stands for alone. Baby should be alone in the bed. There should be nothing, including other people, that a baby could roll into. So I think that is more important when it comes to suffocation and strangulation. So babies can roll into pillows or bumpers, or if they're in the crib with another person, a parent or a caregiver. Or, the thing I see pretty commonly with twin parents, you don't have a lot of room, so people end up putting the twins in the bed together, and babies can easily suffocate on each other as well. So they should be alone in the bed. They should always be on their back. We know, babies on their belly, first off, can kind of get suffocated if their face is down in the mattress, and that can be problematic. But we also know being on the back actually reduces the risk of SIDS as well, which is unidentified cause of death. And then C stands for crib, or a safe sleep environment. So we want them in a safe sleep space. That does not mean a swing or a rock and play. That means a firm, flat sleep surface, which can be a crib, a cradle sometimes can be a safe sleep surface, and then pack and plays as well.
Yeah, that kind of led into another question I was going to ask. Like, if you're traveling, if you say you're on vacation or you're staying with some friends, so packing your pack and play, that's an okay thing to do.
Absolutely. Pack and plays can be a really great safe sleep environment. And there's actually some local and some national organizations that give pack and plays out for families who are scared they don't have a good safe sleep environment for their baby to stay in. I also think it's a great option for parents who want the baby to be in the room with them, especially when you're breastfeeding early on, or even just feeding in general. You are up a whole lot. So those few extra minutes of having to walk in another room, that time is precious. So being able to have your baby in the room with you, but in their own safe sleep space, is important. And a pack and play is a good way to accomplish that.
Sure. What about something I'm thinking about is car seats. Babies fall asleep in the car when you're driving from one location to another, and you get home and you don't want to wake them up and put them in their bed. I mean, how safe is it to just let them stay in the car seat?
It's not. And in fact, even when they're in the car seat, asleep in the car with you, if you're on any lengthy trip, I think the best thing you can do when it's at all feasible is have an adult or an older child in the back seat that can watch the baby sleeping in that sleep position. Their necks can kind of get a little crooked down. It can make breathing difficult. And in the car or at home in a car seat, you may not notice that. So as soon as you get home, if you want to drive around and get your baby to fall asleep in the evening, as soon as you get home, you've got to get them out of that car seat and into a safe sleep environment.
Gotcha. And just a reminder, for those of you who are joining us, if you have any questions or any particular situations that maybe you'd like to hear Dr. Treme's advice about safe sleep environments, please put your questions in the comments below, and we'll get to them in just a little bit. So are there any items that you would suggest that would help reduce the risk? Like, I know a lot of people put the owlets on their baby registries. What about those, that new technology?
So, I think if you talk to 100 pediatricians, 99 of them would say you do not need an owlet. Owlets have some, they're not medical equipment. They certainly give you false positive alarms. And I promise you are not going to sleep after an alarm goes off that night, even if you know your baby's fine. But it also may not go off when there is a problem. And so it provides this safety net, which isn't always actually that safe. But more importantly, I think the reason that sleep advocates kind of steer parents away from things like owlets is parents don't necessarily use them in conjunction with safe sleep practices. So, I think we all kind of get comfortable. We think, oh, I have this way to make sure my baby is breathing well. I can know exactly what's happening. So tonight we're really tired. I'm going to go ahead and put my baby on its belly. And then if anything happens, I'll know that it's happening. And so that's where the problem kind of comes in with things like owlets or other sleep monitoring devices. So we recommend always using Safe Sleep. If you're going to use the owlet, please make sure you're still practicing Safe Sleep in all the other ways as well.
Gotcha. Now, what about like sleep sacks? I know that's a good. We usually discourage blankets just because it could kind of cover their little faces. But what do you think about sleep sacks?
Yeah, sleep sacks are awesome. They've come into favor in the last few years. Babies tend to want to feel like they're in their mama's belly when they're sleeping, and so swaddling has been an effective way to help babies sleep for a long time. The problem with swaddling is blankets get loose. Babies are little Houdinis very often, and they can get arms out, they can get things moving around. And so we don't want a loose blanket ended up in their face that they could suffocate on. A sleep sack is kind of like a swaddle. It's a little sack that you put the baby in, and it either zips or Velcros across. There's lots of different options out there. So it provides a swaddle-like environment for the baby that is a safe environment as well. But I do recommend that you read the instructions whenever you get a sleep sack and make sure you're using it correctly, because some of them I have seen some very tricky ones.
Great. So what about anything else? Is there anything else? You had mentioned the recall on, or you'd mentioned the rock in place. I know that there's a recall there. And then also, little items that may prop the babies up. If you think about it, like, it seems like if I position my baby and, wedge something, a little boppy or a wedge underneath them, then maybe they won't move. I mean, is there anything, other items?
Yeah. So in reference to the wedges, there are products out there, and I think they're probably well-meaning products. They think, there are wedges that keep them on their back. There are wedges that keep babies on their side. The problem with that, again, babies are Houdinis. They get out of all kinds of contraptions, and we don't want anything that can become a suffocation risk. So wedges and positioners, we just don't recommend that you use. But there are, a lot of people for a long time used rock and plays because babies seemingly slept so well in them. They are kind of cradled in that environment, which again kind of makes them feel like they're in a mama's belly, so they tended to sleep well. The problem with that is babies were kind of getting into bad positions. They would roll or move around, and there were, I think, almost 30 infant deaths associated with rock and play uses. So those came off the market a couple of years ago. I do unfortunately still hear that some people have access to them through friends and family. So if you have one, please get rid of it. But there is a new recall that just came out, I think, last week, and that's the Boppy Lounger. Not the Boppy pillow, not the C-shaped pillow that you use for nursing and, having the baby sit with you. But the Lounger kind of looks like an over upholstered chair seat thing. And it kind of puts the baby, it makes like a little bedding environment and has them kind of sit at a bit of an angle. Boppy loungers, as well as DockATots and other kind of contraptions like that, they all say they are not intended for sleep, but they're kind of advertised that way. So it's kind of tricky for parents to figure out, unless they're reading the fine print on the box, that they should not be sleeping in those environments. And unfortunately, several babies have died sleeping in that. So if you're going to use a product like a lounger type of product or a swing, use those for wake time, not for sleep time.
Okay, that's good to know because, yeah, with those advertisements, a lot of times you see a sweet, cuddly baby taking a nap, and it's maybe not the best use of those items. So at what age, in your advice, should we be able to relax about these safe sleep protocols? Is it when they can start moving their head around themselves or flipping over? When can we relax?
So certainly the highest risk of SIDS is between 2 and 4 months old, but strangulation can happen at a much older age. Most of the studies that are done on SIDS and SUID deaths, the risk of childhood death goes down dramatically after a year. So I think you still have to be vigilant, but you can be a little bit more comfortable that your baby is going to be okay after they reach that 1 year mark. And that has a lot to do with their development and their muscle tone and their ability to get out of a bad situation. A lot of parents want to know when they can put a blanket in the bed with the baby. Again, I think you have to be careful about that. I wouldn't use those really soft bamboo stretchy kind of blankets because, again, that can become a strangulation hazard. But after a year, if your baby's really cold, I think having something thick, not too thick so that they're too hot, but something thicker like a cotton material that doesn't stretch as easily can be a safer option.
Okay, and worst case scenario, this is what we don't want to talk about, but in the worst case scenario, what are the first steps that a parent should make if they notice something's wrong, if they go to wake up their baby, or they just check in the middle of the night? What should they start to administer CPR? What are those steps?
So I guess that kind of depends on the parent and what their background is. So right now, for any parents listening that are pregnant or have an infant, if you can get into an infant CPR class, I think that's very helpful just for that reassurance. But the first step always, no matter what, is get your baby out of the situation that they're in. So if their face is kind of in something, if they've rolled into a product, or if they're on their bellies, anything that you need to get them on their back, flat on their back with nothing in their face so that they're able to breathe if they're able to. And I think the second most important thing is call 911. So all of us, myself included, when it's your child and they're in a bad situation, you kind of lose your mind. So calling someone, a professional that can help you and can get 911 or the paramedics on their way to help you out is important. And we are so fortunate we have awesome dispatchers here that can really help walk you through what to do in those couple of minutes until EMS arrives.
That is such a scary situation. And I hope that nobody has to deal with that. But the reality is that we do need to talk about those first steps in case that we find ourselves in that situation. Again, if you guys have any questions, those who are watching, if you have any questions, please put them in the comments below and we'll get to them in just a second. So I want to hear too, Dr. Treme, what is your advice in talking to family members? I know there's situations where maybe babies go stay with the grandparents, and the grandparents may have a different set of protocols or aren't as cautious as you would be as a parent. What is your advice in talking to those family members?
So, I think we have to acknowledge to them that they did a great job raising us, right? Whether it's a grandparent or an aunt or uncle, they've raised us and we survived. And so they have confidence there, and acknowledging that they are good at what they do and just that things have changed is really important. This shouldn't be an attack, right? It's something that we're all doing together. The next thing I think is if you really try to appeal to a parent's or a grandparent's safety side. So every grandparent that I know, including my own little girl's grandparents, are the fiercest advocates for their grandbabies, right? They want the best thing for their grandchild. They want to know how to keep them safe and how to keep them comfortable and feel loved. And so appealing to that side, saying, I know this is what you want for your grandbaby. I know you want them to be safe. Here's how we can do it. Let's go through some reading material together. Let's come up with a plan at your house. And really talking through those scenarios. I don't think that you can assume that anyone knows what to do in these situations. Things, like you said earlier, things have changed dramatically in the last 20 or 30 years. And so a lot of grandparents just aren't aware that we know so much more now about how to keep their grandbaby safe. And they are more than willing to jump on board with you when you have that discussion with them.
Yeah. What do you think is the most important piece of advice that you have as a mother to help parents understand how important this is? Because I think a lot of times people think, oh, that's not going to happen. This is just, I'm just falling asleep with the baby in the bed for a little while. It's not going to happen to me. What is your most important piece of advice as a mother?
Yeah. So if you ask my 5-year-old what my number one job in the world is, she will very quickly respond to you, to keep me safe. Our job as parents is to keep our baby safe. I think every parent out there knows that, and every parent out there feels that very deeply inside of them. And so, at the end of the day, we may be tired, we may be absolutely exhausted, but our job is still to keep our baby safe. And I think having a plan for what you're going to do when you are way past that exhaustion point is really important. Think about it now. Think about talking, if you have a partner at home, talk to them about who's going to take care of what to do if you get to that point where you feel like you could fall asleep with the baby and not do it in a safe way. Ask around. You may have grandparents that are more than willing to come spend the evening with you sometimes, or good family friends that you trust to take over, between feeding times overnight. A lot of people are willing to help. You kind of have to put that pride aside and ask.
Great. Well, let me just get to a couple of questions that we have in the comments. And again, if anybody has anything, just go ahead and add that to that list and we'll get to them. First, we have a question that says, my baby is almost 6 weeks and he refuses to sleep unless he's in someone's arms. And even after he's asleep and you try to put him down, he wakes up. I'm losing it trying to figure out how to handle it.
Yep, that is probably the number one thing I hear around this time. They do not like to sleep. And again, they just want to feel like they're in your belly again, right? they're kind of waking up around that 4 to 6 week stretch. They're starting to realize that they're not in their warm, closed-in little environment, and life is really difficult, and they don't want to sleep. Their days and nights are still pretty mixed up at this point. And so sometimes during the day, they sleep fantastically all day long when you actually have to do things. And then all night long, when you're trying to get some sleep, they're wanting to be awake. So a couple of things you can do, at the end of the day, you got to do whatever you have to do to get your baby in that safe sleep environment. And I promise it's going to get better very soon. Usually that 2-month mark really makes a huge improvement. But babies want to feel warm. So trying out some different swaddle blankets. There are a couple, the Nested Bean, I don't know if I should use products on here, but there are a couple of products that have little weights on them on their chest that kind of put some, not firm pressure, but just a little bit of weight on their chest can help them fall asleep a little bit better. There are tons of different sleep sack options that I would start asking every friend you have, do you have one of those products? Can I borrow it just for a couple of nights to see if it works for my baby? Because no product works for every kid. Something else that I like to recommend to moms is get a heating pad on a real low setting and put it in the cradle or the crib that the baby's going to sleep in, and let the bed get warm before you put the baby down, and then take the heating pad out. So that it's just a little warm, not hot, but just so that the baby doesn't hit that cold surface and startle. Because as soon as you initiate that startle reflex, they're going to wake up. They're going to, their little body's going to move, and it's going to wake them up.
Yeah, so, I'm thinking about this question, and if you're holding the baby and they're staying asleep in your arms and you're awake, how unsafe is that?
As long as you're awake, I think you're fine. The problem becomes at some point we get exhausted and we lay down on the couch, or we think I can just sit in the bed for this feeding, and then we fall asleep. So if, worst case scenario, especially week 6, to the poster who posted this, this is the hardest week of your baby's life. If you can find somebody to switch out with and let that baby sleep in someone's arms for the next couple of nights, and so everybody can get a little sleep, that is okay. But someone needs to be awake with the baby during that time. So find some people you can switch out with. If you have a partner at home that you can switch with, one person takes a couple of hours and then the next person takes a couple of hours, but do something that you're going to stay awake with. Turn a TV show on that's exciting. Don't let yourself turn the lights down and fall asleep.
Right. Okay. And one more question. What if my baby rolls on their tummy while sleeping? Should I put them back on their backs?
That is a great question. So once babies are strong enough to get into the position of being on their belly, they are fine to be in that position. That comes at different ages for different babies. Generally, rolling back to front is around 5 to 6 months, but some little Houdinis do it very early. So if they roll into the position of being on their belly, they can absolutely be there from that point forward. You just don't want to put them in that position when you put them down. But once they do roll onto their belly, they've got to have arms so that if they, get into a bad position, they can get themselves out of it. So unfortunately, rolling also means no more swaddling.
That's a very good point. I didn't think about that, because when they're in those sleep sacks, they have their arms free that they can kind of move around and do that kind of thing. Mm-hmm. Okay, we have another question in the comments. One thing we hear all the time is that babies will choke if they spit up while they're sleeping on their backs. Are babies more likely to choke on their backs?
That is a really fantastic question too, and it requires a little bit of knowledge about anatomy of babies' necks to know why that is not the case. So your trachea, the breathing pipe that you breathe down, is actually in the front of your neck, whereas your esophagus, your feeding pipe, is down the back of your neck. So when you are laying on your back, your esophagus, where the food would come up at, is actually behind the trachea. So when babies are flat on their back and food comes up, it's actually more likely to stay in the place that you want it to be than if they lay on their bellies, where the trachea is now below that feeding tube and food can come up and go down into the wrong hole. So being on their backs is actually a safer thing for babies who are refluxing.
Wow. Okay. That makes a lot of sense. So another question, I've heard pacifiers are a good thing to prevent SIDS. Is that true?
That is absolutely true. Obviously not every baby will take a pacifier, but for those that will, having a pacifier during naps and sleep time has been shown as a risk modifier in helping to prevent SIDS. And speaking of which, a couple of other things that can help reduce the risk of SIDS, which is sudden infant death without an identifiable cause. So not smoking in the house is super important. So if you are pregnant and you are smoking, now is the time. I know it's hard, but try to break that habit for your baby's sake, because we know that babies who are in environments where there is smoke in the house are at a much increased risk of dying from SIDS. Pacifiers are really important. Getting prenatal care has actually been shown to decrease the risk of SIDS. Breastfeeding for those families where that's something that can viably happen and decreases the risk of SIDS. And then coming to checkups, talking to your doctor so that we can help identify things, and getting vaccines actually both have been shown in studies to help reduce the risk of SIDS.
Great. Well, I think we're just going to wrap up here, but I think this is all so informative, especially for me, and I know for our viewers as well. These are all things that it's a hard topic to talk about, and because we know how precious these children are, and we don't want anything to happen to them, but it's important to know these details. And I think one thing that I'm taking away from this discussion really is that, as hard as it is to have this discussion, it's super, super important. So thank you so much for joining us and kind of giving us the hard truth here of how we can keep our babies safe. I do have one last question, and we're talking, it's a little bit fun on a lighter note. We are talking about putting babies to sleep. I know when I was a child, my mom always read a book to me at night. And so I just wanted to know, do you have a favorite children's book or story that you like to read to your kids?
Yeah, so we are avid readers, and as a side note, reading is super important for cognitive development. So I absolutely recommend moms and dads out there get to reading with your baby very early. We have always read before bed. My favorite book was probably Chicka Chicka Boom Boom. It's a cute little story, but we are big Eric Carle fans in this house, and The Very Hungry Caterpillar was on repeat for a very long time. I think my 2-year-old could repeat it to me for months without reading it, because she just knew every word.
Yeah, that's awesome. Yeah. That is awesome. And yeah, we are not sponsored by any of these products or books. Well, thank you, Dr. Treme. We really appreciate it. Do you want to share how someone can get in contact with you if they need a pediatrician?
So our clinic has 12 pediatricians. And so if you are a new mom who has not had her baby yet, you can just show up at the hospital and tell them you would like to use the children's clinic, and they can put you in touch with us. If you are interested in having a prenatal consult, if you just call the main children's clinic number, we have someone who can schedule that for you.
Awesome. Well, thank you so much, and we will be in touch. But thank you guys for joining us for this episode of Live and On Call. We enjoyed our chat with Dr. Treme, and we will see you soon.
Thank you for having me.
Thanks.
Bye-bye.